in terms of the procedures, I think, Paola, this perhaps may be for you.
So as outlined in the previous webinar, and more recently when we had the bilateral with the industry representation, FIA and the other organizations, so the agency is currently evaluating the introduction of the SEPA direct debit system. And with that, that works basically by the company, whoever subscribed to it, giving a mandate to the agency to go and collect the fees. This is a system that would be suitable for high volumes, low value, of course, because there will be limits on how much money then can be collected. So that is one way. And then looking at this question specifically, I have to assume that by provision, by organization, we mean a deposit. So basically a lump sum payment that then from which the agency would then withdraw the amounts and allocate against the various invoices. This is also being looked into, and the difficulty with this one is that we do not have a clear legal act or a legal provisions supporting this at the moment. So we are looking if there is a way to work around this and overcome this formal block that we have at the moment. Yeah, but I will just provide a reply in writing, along these 2 points. Yeah, so thank you.
Okay, great. Thanks, Paola. Okay, so we have another question about CPS, whether we have a dashboard to see a list of all of the requests. And for that, Mirka, perhaps you want to provide any insights?
Yeah, I'm happy to answer this one. Thank you. So currently there is no dashboard available where you can track your requests. Your status can track only via the emails. So you receive always email notification when a request is received and processed, and when an invoice is created. So that's currently the way how you can track.
Great, thanks, Mirka. Okay, so next. Okay, so we know there's no separate fee for minor type 1As and 1Bs because these are included in the annual fee. So the question is, how will the fee be calculated? So for this, I think I'll go to Claudia.
Yes, indeed, these are being moved to the annual fee, and the annual fee is a fixed fee. In accordance with the new fee regulation, there will be no calculation per product. So whether you have minor type 1A and 1B in terms of volume, or several, those are all clustered in the relevant annual fee according to the legal basis of your product. So there is no estimation or based on submission.
Okay, thanks, Claudia. So yeah, fixed annual fee. Okay, now this one I think is a comment, so it doesn't really require. Now, in terms of CPS, the question is whether the start date of the procedure is the date of receipt of payment or the date of the request made in the system.
The processing of the certificates starts the day after the payment has been received. So this is the answer.
Exactly.
So the date when the payment is received is when the requester receives confirmation that the payment has been received and a formal request number is attributed to the procedure. This is the way the process has been designed. But Miroslava, if you have more details on this, because this is the part of the process that occurs, yes, in the operations. Yeah, for sure, we know that the moment we allocate the payment, then it starts. Yeah, the day after. Yeah.
Yeah, exactly. I think that's the change that we wanted to highlight. So the start date, let's say, where you start calculating the 2 or the 10 working days to receive the certificate, is not the date or the moment where you submit into CPS. Okay, so let's see next one. So Annex 1, Section 4. The fee covers a single pharmaceutical form and a single strength. Question is whether there are any fees for additional strengths or presentations included in the same extension application. So I think I'll go to Claudia for this one.
I can take this. Indeed, if there is an additional strength or an additional pharmaceutical form, the field will be replicated, so it will be added. Of course, presentation are not fee multiplying, so but if the fee will be calculated at the level of additional strength or additional pharmaceutical form.
Okay, thank you, Claudia. So, more information about the pharmacovigilance fees and the chargeable units. How can a market authorization holder calculate the due fees? So that's human pharmacovigilance. Yeah.
Maybe I can take that one. So regarding, well, anyway, for all procedures, we have published the question and answers and 4 different annexes, and the calculation, let's say, of each fee type and also for the pharmacovigilance fees is very well explained in the question and answers of the respective annexes. And for example, in section 14 of Annex 1, it's determined how the chargeable units are calculated step by step. For example, here's the name of the product, the marketing authorization holder, the member state, or the pharmaceutical form which play a role. So it's a combination of different factors which are very well explained in the question and answer which we've published on the website. But in a nutshell, it's the factors which I just mentioned.
So if I may complement to this, the calculation of the due fee is really depends on the type of procedure and how many marketing authorization holders are involved in the procedure. We're talking about PSUR and referrals here, because for annual pharmacovigilance annual fee is a multiplication of the chargeable unit, and you will receive the statement of the chargeable unit with the advice note. You will also receive an advice note with the PSUR and referral, but this is there is a division factor depending on how many marketing authorization holders are involved in the procedures. So this will determine the actual fee that you will pay. And this cannot be calculated in advance. Unfortunately, this cannot be planned. It will be known only at the production of the invoice when we gather all the chargeable unit inherent to the procedure.
Clear, thank you. Okay, so the next one is about moving the intended submission date by more than 60 days with the additional charge of 4,200, and the question is whether this only applies to initials.
Yes, this is, I can take this, this is related only to initial application. So the pre-submission fee is foreseen only for initial applications.
Okay, and then, so is the CPS platform already mandatory, or can we use the previous request form for a while? No, I think I can confirm that this is mandatory, so we will accept only certificates request via the CPS. And then we have, what about fee reductions for SMEs who are developing a product in an indication which is not orphan? So any other fee reductions that we can roll out for SMEs other than orphan? Don't know if Patrick or anyone has it.
Yeah, if there's of course an orphan product involved, then I think there's a fee incentive of 100%, but for SMEs there's at least a fee deferral for initial marketing authorizations. But of course then it depends, so that's for initial marketing authorization, but the SME incentives are there for all the different products as well, and it depends on the procedure, how high the SME incentive is. What we can also tell is with the new fee regulation, which provides some SME incentives, there's still, of course, the old or the SME regulation in place still remains valid. So the SME incentives which are stemming from the SME regulation are still valid, and the fee reductions which come from the new fee regulation are on top. But for initial marketing authorizations, there's a deferral for SMEs, if not orphan.
Great, thanks, Patrick. Okay, so next we have scientific advice. With the fee calculated during validation, industry may only have 5 days. Okay, so this is a similar question about the prepayment process and the timeline for payment. I know, Paula, you offered a few, let's say, insights on what other payment methods we may look into, but for now, do you want to add anything in terms of what we've seen so far, perhaps?
Well, with respect to this question, what we can say at this stage, and that might have been noticed by the industry already for this run of scientific advice start of procedure, which is starting today, is that the validation time has been shorter compared to January. So we have been able to issue invoices much earlier, by some of them already 28th of January, so giving quite a margin as well for payment. Yeah. So the method of payment for here, the SEPA direct debit that I mentioned earlier would probably be not suitable due to the high value of these payments. Of course, there are limits that we have to communicate to our bank of how much because, as you know, the SEPA direct debit basically is a system whereby the bank would anticipate the amount to us and then they come and collect to the companies. It carries its own risks because if the company from where we collect the money, I mean, this happens maybe more in the private, for the private individuals, but if the bank will not find the funds there, then it will be rejected. So we will remain without payment. So there is obviously a risk element, a trust element on it. And when I say that it is more suitable for small amounts, is also because of these reasons. Yes. So there is also another question coming up along these lines, which I will reply. But for this one specifically, to revisit the process to allow more time for payment of this fee. So we assume that the payment will continue with bank transfer because the amounts are large in this case, and the bank transfer is the most suitable payment in this case. What are we doing here is to make the validation cycle a little bit shorter so that the time for payment is therefore longer. Yeah, and the example is for the invoices that have been issued at the end of January, 28th and 29th of January. Others have been issued on 31st of January as well, but no one on the 3rd, which was the date that we have set as a latest date for issuing the invoices. Yeah. And so we will reply to this question, but I don't see that the question here is method of payment. Yeah, it's more the time given to pay in order to make it for the start of procedure.
Yeah, thanks.
I can also answer the next one. Yes, so the scientific advice planned in March, I think is also a start of procedure, 10th of March, because I think February and March are the same. The dates are published on the website. So the invoice is expected to be issued any time between the end of February, so the last week, I would say. February is 28 days, and by the 3rd of March at the very latest. So to make the payment, in order to have the request to be considered in the start of procedure March, the payment has to reach us by the date of start of procedure, which is the 10th of March. Yes, so, and otherwise it will go to the following, to the April round, basically. And so we will reply in writing on this. Yes, so in details. Yeah, thank you.
Thanks, Paola. Okay, so this question is about clinical trial application, whether there are any reductions for SMEs and which fees are applicable. And then maybe we can look into the third one as to whether they are the same for ATMPs. Do we have?
I can take this. At the moment, there are no clinical trial application fees. If the review of clinical trial application is within a scientific advice request, of course, the scientific advice request will apply, and there will be a reduction for SME, and so there is a clear explanation of the scientific advice reduction applicable. There are several for scientific advice, but for clinical trial application, there is no fee. And I think there was another question on clinical trial. Maybe we can take that as well. No, okay. Yeah, this one. What happens? But we can take scrolling it later on. That's fine. I can take the next one, scientific advice on product developed for pediatric population. No, sorry.
Sorry, Gladio, we're on the, I don't know if
Paola, yes.
Has, thoughts on
the UK Northern Ireland situation is applicable. I mean, it really depends on the procedure. For centrally authorized product, there is no more requirement to have a fee for UK Northern Ireland as state of origin. So if your procedure is a pharmacovigilance procedure and you have chargeable unit inherent in the calculation of Northern Ireland, this will have been removed. However, the products classified as nationally authorized product in the realm of pharmacovigilance chargeable unit are still being calculated with UK Northern Ireland.
Great, thanks, Claudia. Okay, so we have another couple on scientific advice. So do we take into account the wire transfer notification, or we only consider when the payment is visible?
Yes, I can take this one, and I've also replied already, but so for scientific advice payments, but for all payments in general, so and I'm quoting here the article of the regulation, the date on which the full amount of the payment is received in the bank account is considered when the payment has been received. So we have to have it in the bank account. And that with that, then we are able to allocate it to the correct procedure. So the remittance advice that companies kindly send to our accounts receivable AR department team, I would say, helps us to identify the payment and allocate it to the correct procedure in case of missing or incorrect reference on the bank account transfer. So, but if generally all the receipts are matched automatically against the invoices, sometimes the numbering, either there is a zero difference or so. That's why with the remittance advice, we basically confirm that the payment is indeed meant for what is being processed. And but yes, so we consider, the answer is that we consider it when it's visible in our account.
Okay, great. And so another one about what happens when there are scientific advice fees waived. So how does that work in terms of what will they receive? Is that an invoice or?
Basically, what Emma is producing an invoice, which is 0 invoice value. So it's just for the reference, and it goes to the standard email address, which is in our database. So any applications which have 100% fee waivers, any incentives, 100% incentives will receive always invoice with a 0 amount for the reference. Thank you.
Great, thanks, Alina. Okay, so this question, maybe, I don't know if we need more insights. What about fees and chargeable units for PSURs? Maybe if you want to provide more context. Okay, so I think there's a follow-up question as to what Claudia was explaining in terms of the multiplied fees for the strengths. So is this understanding correct, that for each strength there is
Correct.
a fee?
Yes.
Okay.
That is correct.
Good. Okay, so then we have for procedures that no longer require payment, for example, a renewal. What should sponsor put in the cover letters to highlight the sponsor account number, but no fee payment required?
Or they can put not applicable, or now I don't know if the cover letter is a free text or a table where they need to insert mandatorily this account number. I don't recall this being mandatory in the cover letter, but they can put not applicable or no fee payment is required. That's fine. Yeah.
Okay, thank you. So next, can we know what procedure has changed regarding fee payment and how much to pay for initial marketing authorization application or dormant?
This question is a little bit broad. Almost all the fees have changed, and I invite whoever has wrote this question also to have a look at the various webinars that we have done in the past, and they are available on our Emma fee landing page, because this is explained in those webinars. So it's really depending on the procedure, annual fee, initial application. So in initial marketing authorization, the fee has changed significantly. It is now significantly higher because of now it's reflecting the actual true cost of the effort for EMA and National Competent Authority to assess an initial marketing authorization application, but it also depends on the legal basis of the marketing authorization application. So from before, we were charging a granularity of an initial marketing authorization fee according to how many strengths, how many pharmaceutical forms, how many presentations were part of the initial marketing authorization, and subsequently also the fee was slightly changed according to the legal basis, but not of much difference. Now all of this has been removed, and we have a flat fee according to each legal basis.
Great, thanks a lot, Claudia. So I think we have Anna that could just elaborate on dormant products and also the UK&I question. So Anna, yeah, if you want to.
Yes, good morning. There might be a chance that this question does relate to parallel distribution, actually, as we do have a concept of dormant product. So we'll try to elaborate further in writing, but in addition to what Claudia has mentioned, the fees regarding here, probably initial notifications for parallel distribution, maybe. The fees are outlined in the regulation and the Q&As, and you are kindly advised to refer to the documents published for the amounts payable. And with regard to dormancy and activation of dormant notices, The applicants are required to activate by submitting update of parallel distribution notice notification. It is free of charge. The activation process and putting dormancy is also free of charge. It merely updates of the status of the regulatory entitlement. And hopefully that answers the question, and then we'll provide a more detailed reply in writing.
Thanks so much, Anna. Great. Okay, so in the scope of scientific request validation, is it planned or possible to provide the request for fee payment and the confirmation of validation in one message? I will go to Paula, but perhaps these are inherently different things, right? So
yeah, I mean, the way the process is designed at the moment is that the process is in IRIS, where the confirmation of the validation, the notification is sent, and at the same time the invoice is issued, which goes to the designated address for financial matters, as it is the case for every other invoice. Yeah, so it is over two different messages, but it is at the same time. Yeah, so I mean, so maybe a couple of minutes or half an hour difference. So it depends on how the system elaborates the information. Yeah. So if the question here is it possible to have the invoice from IRIS, that it is not implemented at the moment. The invoices goes out as from our financial system, which is SAP, and they go out in the same manner as everything else. So this is really the distinction. Yes. So the answer, I'm afraid, is no. But yeah, I mean, so it is not planned either, but we are aware of this question, yeah, as well, if I may say so.
Mm-hmm. Great, thanks, Paula.
We are aware of the importance of the question, I should say, yeah.
Yeah. Okay, so now for an initial application submitted through the gateway in 2024 with a start date in January, which fee framework, so the old or the new fee regulation applies? So maybe Claudia or Patrick?
Yes. Patrick, would you like to reply or?
Yeah, I can go. So this is a case which falls a bit into to transition measures, let's say, which I refer again to the question answers outlined in point 2.6 of Annex 1. And it depends here when the administrative validation is ended or is done. So if this is or was on 31st of December 2024. So I'm talking about the administrative validation. If this was done in the old year, then it's the old fee regulation which applies, because this is when the fee becomes due. If the administrative validation, however, lies in 2025, then it's a new fee regulation which would apply.
Yes, good. Thanks, Patrick. Okay, so another one on scientific advice. So will the reduction of timelines of the issue of the invoice also be reflected in the package validation timelines? So will this be reflected in the timetables? So I think this refers to what Paula was saying, that we will try to issue the invoice as soon as possible for scientific advice. But we will not change the timetables, right? Maybe we can also get back in writing in the...
Yes, but in a nutshell, the validation, the scientific advice timetables remains the same when there is a submission date and the predefined started procedure. Yeah, so it is the payment process that has been included in between. Yeah. So what we say on the validation, on the timetables that is published on the website is what is it the expected validation date, not the latest expected validation date. So that is the date at the maximum when we will validate the application and when the invoice will be issued. Anything earlier, the better, of course. And as I said earlier on, for the procedure starting in February, we already seen almost a week, or at least 4 or 5 working days earlier, with invoices being issued on the 28th of January as a result of an earlier validation. And so this is at the moment, yes, how it is designed, and yes, so the reduction of timelines of the issue. So to answer the question, we are not gonna change the timetables, because the timetables is already saying at the latest, yes. So, and obviously it can happen at any time earlier than that. There are some requests that are simpler, other that requires a longer validation. So this is the reason why we have a range of dates. Yeah.
Okay, great. Thanks, Paola. Okay, so this next question, what happens if a certificate is issued incorrectly, and how will the replacement be managed? So I can provide an answer here. So if a certificate is issued incorrectly, the applicant should contact the certificate inboxes. So that is either certificate_urgent@ema.europa.eu or certificate@ema.europa.eu for standard procedures. And if a correction is made and after investigation this is due to an EMA error, then a new invoice and so new payment will not be requested. Okay, so this question actually we've had also in writing several times. So I think we can, it's good that it came up during the Q&A. We were actually hoping it would come up. So I will provide an answer, and then if you guys want to add anything, but the remuneration for the rapporteur is paid by the agency, and it's not to be calculated on top of the fee. So that is confirmed in terms of the 34,000 would include the 17,000 that the EMA then pays to the national competent authority. So yeah, it's not for marketing authorization holders to pay this. It's just the way that the new fee regulation is formulated that now calls out the remuneration for the competent authorities. Then, okay, so this is the other question on clinical trials.
Take this. I mean, I'm just looking from the fee point of view. As I said before, clinical trial applications do not bear a fee, so I'm not sure what the same or less than medicine plus medical device and non-CE marked, that's not applicable. So
yeah, so maybe that's the answer. But if you want to provide any more details, then just feel free to send them over and we'll check them. Okay, so will there be an overview table with fees and reductions per activity? So I think that's the answer is no. We decided to change it up a bit this year with the new fee regulation, and we provided the fee Q&As that can be consulted, and they are on the EMA's webpage. We also carried out a few webinars where we went through procedure by procedure, what changed and what details. So you can, these materials are available, you can consult them, but we will not be adding a table per se.
Valeria, if I may add here, so in the past, there were the implementing rules and explanatory notes, so those documents are not there anymore. But indeed, what we have on the website, so if you go on the EMA webpage, or by simply Googling EMA fee website, you get, of course, the link to the new fee regulation itself. Then a second document to look at are the working arrangements, which are clarifying a lot, which is in the new fee regulation. And then the third item are the question and answers, which Valeria just mentioned, which are drafted in 4 different annexes, and in each annex we explain if there's a fee to be paid, what are fee incentives, also about the transitional measures. So there is not, let's say, a unique table like in the implementing rules or as in the explanatory note, but there are those fee Q&As per procedure type where also all the incentives are summarized.
Yeah, thank you, Patrick. I was just showing what you were saying. So all of the Q&As and then the working arrangements. So it's all in one page and you can consult them all.
But we decided to keep all the amounts referred only in the new fee regulation. So if you want to know the amount, you really need to go to the relevant procedure in the relevant annex, and there the amounts are clearly stated. And we didn't want to maintain several tables because now the granularity is quite high in terms of procedure and amounts and also remuneration to national competent authority. So the risk of stating a wrong fee is quite high. And we felt that since it's clearly explained in the new fee regulation, the amounts are there. And the calculation of the fee reduction is then referred to with the question and answer, the applicability.
Yes, thanks both. Okay, so when is the annual fee invoiced?
I can take this one. The annual fee for medicinal product, centrally authorized product, is invoiced at the anniversary of the European birth date of the product. So it is the process not been changed from the production and invoice point of view. What is changed is the calculation of the fee. So before it was indeed calculated at the time of the European birth date, together with the relevant reduction and fee due date calculation. Now the fee due date has been moved to the 1st of January. So any applicable reduction, any applicable fee for each medicinal product is computed on the 1st of January. So we calculate the fee at the 1st of January. Of course, we don't send the invoice because it's not been mature yet. But at the time of the European birthday, the invoice is triggered and sent to the market authorization order.
Okay, thanks, Claudia. So is it possible to withdraw the certificate request prior to payment of the fee? So for this, maybe Alina or Paola, or I can also help with what happens if you don't.
Yes, so basically the concept of withdrawal prior the payment is not foreseen. Basically what you need to do, just simply don't pay the invoice. And then after the 30 days, the invoice will be cancelled.
Yes.
And the applicant will receive, or the requestor will receive notification of the cancelled invoice, and the cancellation document will be sent to the recipient of the invoice.
Mm-hmm. Great. So yeah, simply do not pay within the 30 days.
Yes, and again, if you know that you want to withdraw it or you don't want to pay it, you can always submit a query through the EMA invoicing portal, and then we will make a note that there will be credit note in process. But this credit note in process only will be after the invoice basically will pass the 30 days.
Mm-hmm. Okay, thanks, Alina. And okay, CPS again. What is the delivery time for standard procedure and urgent procedure of the CPP after the invoice has been paid? So here I can comment, and let's see if colleagues want to confirm, but the timelines have not changed, right? So there is urgent procedure is 2 working days, and then standard procedure is 10 working days from the receipt of payment. So not from the time you apply. So that hasn't changed because of CPS or because of the prepayment. So yeah, unless anyone wants to add, I will just go with that. And then, so we are planning to submit RUP. Could you please confirm if it's necessary to pay old CMS too?
So I can take this. This is out of scope on the regulation on fee applicable to EMA, because this is a nationally authorized procedure. It's a repeat use procedure in the framework, I think, of mutual recognition concerning member states, etc. So this is dealt at national level, and you need to check with the national competent authority where you want to submit the repeat use procedure.
Yeah.
And I think this question is also repeated several times. So
somewhere, okay. So this one I think we already answered. It's a repeated question. And then let's see. Okay, so the fee regulation for scientific advice refers to a fee depending on the type of request, and also mentions remuneration for each coordinator. So does that mean it's, for example, okay, so that's again about the remuneration to national competent authorities. So the fee that you find in the new fee regulation is the one that you have to pay. Whatever is the remuneration is not for market authorization holders or applicants to pay. So you won't have to pay that amount on top of the fee. Also, let's see. So we mentioned SEPA is suitable for low value transactions. Is the plan to restrict SEPA to the prepayment procedures, or does EMA have a longer term plan consider a broader range of application?
Yes, so just to clarify that we talk about SEPA direct debit here. So SEPA direct debit, not SEPA transfer. And yes, the only reason why I said that is not suitable only, but would be most suitable. It's all about daily limits of transactions and the difference between certificates of 200 euros versus a scientific advice of 98,000 euros. So the work that is ongoing at the moment, as we are dealing with our payment service providers, which are our banks, is to define what are the daily limits that they will allow for the processing of SEPA. This is not unlimited, yes? So we have to agree with the bank first what would be the daily limit, because as I explained earlier, the process is that once we set the instruction, they will send the amount on the bank, and then they go and collect from the customer, our customers that gave the instruction. So there has to be this agreement with the bank in place. So at the moment, we are trying to estimate what would be reasonable limits just to start, but most importantly, you know, the whole system is really to facilitate the processing of the prepayments first, and then they will also be available to many other procedures, but again, depending on volumes and limits, because these are the things that we have contractually to define with our banks. Yes, so potentially there should be a broader range of application. I would see, for example, very suitable to pharmacovigilance annual fees and all those amounts that are, you know, well established and low value, high volumes as well. Yeah. So I will reply on this one in writing, giving a little bit of more information on how we are developing the system right now. So the work is ongoing for this, as I explained also in previous webinars. Yeah.
Thank you, Paola. Okay, so now regarding initial application as a parallel distributor, when to pay the fees and how much to process the application further?
I can also take this one. Yes, so in general, not only for parallel distributions, the payment shall be done only after an invoice has been received from the agency. So you have to wait for an invoice to be issued. It will be sent to the designated financial contact points we have on file. The moment when you have the invoice, then you can process the payment, because we need to have back the invoice number so that then we can allocate it to the procedure. So you don't have to pay when you submit, you have to pay when you receive the invoice. and the invoice is actually received for parallel distribution applications at the moment when the submission is sent through the system. So I believe it answered the questions. Yes, so it's certainly not before, but after an invoice has been received. Worth noting that the processing of the applications for parallel distribution, initial application, will not start until the payment is received.
Okay, thank you, Paola. Okay, so last two questions, because I think we'll have to close the session then. But so the first one is, can you confirm if pharmacovigilance fee for PSUR has not changed since 2023 in accordance with Article 57 database, and the fee will remain the same pre-2025 fee changes?
I can take this one. So the pharmacovigilance fee for PSUR was regulated before via the pharmacovigilance fee regulation, and this was valid until 31st of December 2024. And all PSUR procedure for which the start date will occur as of 1st of January 2025 will have the new fee regulation fee, and the fee will be changed slightly. So if a PSUR fee was charged until 31st of December 2024, it will have been according to the pharmacovigilance fee regulation. So it did not change since 2023. The changes occur from 1st of January 2025.
Mm-hmm.
I think this is also explained in the transitional measure in the question and answer. I can take also the second one, still PSUR. No, it's not clear how this question is formulated from what I read. So if a fee was charged last year, will mean that the PSUR procedure will start. So the PSUR transitional measure will be because of the fee was under the old pharmacovigilance fee regulation. But this will not mean that the timetable will be causing a delay, or there will be a correction on the fee. So we have to take into consideration Article 17 of the new fee regulation and the transition from old to new fee. So if a fee falls under the previous regulation, is charged under the old fee regulation, even if the assessment is then performed in 2025 onwards. And likewise, if the fee due is in 2025, as of 1st of January, the new fee regulation will apply. And there will be no pro rata or correction between the two pieces of regulation.
Thanks so much for participating in this session. Of course, we are glad to support you with the transition, which is very new and very fresh. So it's a learning curve for all. So I think the team appreciates the opportunity to answer questions and to support.